Well, 2 COVID-19 deaths and 2 new cases have been recorded in the last 24 hours, pushing the fatality count to 11 and marking a record 12 cases in the space of a week. 2 men, a 53-year-old and a 51-year-old, have died from complications of the illness. Health officials say the 2 passed away at Doctors Hospital West. As cases rise, health officials have expressed serious concern over the rate with health workers that is, are being affected, as they already account for 20% of confirmed cases. Jimenita Swain has details of the latest update from the Ministry of Health's press conference this afternoon and joins me live in studio with the latest. Good evening to you, Jimenita.
Good evening, Keishla, and good evening, Bahamas. Health Minister Dr. Dwayne Sands confirming Thursday that 2 patients died as a result of COVID-19. During a televised national press conference, he outlined the latest statistics.
Sadly, we announced today 2 additional deaths from this coronavirus. A 53-year-old male and a 51-year-old male who died at Doctors Hospital West. This brings the total number of COVID-19 deaths in the Bahamas to 11. There are 2 new COVID-19 cases. A 50-year-old female of New Providence who is in home isolation, and a 29-year-old female of New Providence who is also in home isolation.
Well, there are now 72 COVID-19 cases in the country with 14 recovered cases. Dr. Sands outlined patient exposure between the Princess Margaret Hospital and the Sandilands Rehabilitation Center.
Days later, the Medical Surgical Ward 2 of PMH was declared compromised on discovery of a confirmed positive COVID-19 patient on the ward. Consequently, the ward was closed to admission on April 18, 2020. The patient of the Robert Smith ward from SRC was returned to PMH on April the 19th to be tested for COVID-19. And on April the 20th, it was confirmed that this patient from the Robert Smith unit had contracted COVID-19.
Well, that patient has also been tested and treated, but the remaining patients in the Robert Smith ward have also been tested. Dr. Sands explained, though, the domino effect of the exposure on the healthcare system.
46 staff members at Sandilands were identified for risk exposure assessment. In total, more than 200 healthcare workers are in quarantine. However, we believe that upon completion of our risk assessment activity, this number is expected to be reduced dramatically. 1 staff member, 2 patients, and 2 registered nurses were quarantined for 14 days.
Again, Dr. Sands says all physicians exposed will be tested. Back to you, Keishla.
Well, Jimenita, just before you go, what did we learn from health officials this afternoon about what changes may be made in terms of the lockdown, curfew, etc. going forward? Do they think it's something that should continue? What is their recommendation?
Well, Keishla, we know that there will be another lockdown this weekend, as the Prime Minister has already confirmed weekend lockdowns throughout the month of April. But consultant Dr. Mercelin Dalregis says health officials do not plan to recommend the relaxation of the current protocols in place, which includes the national lockdown or curfews, anytime soon.
All right, thanks a lot. Jimenita Swain reporting there.